All right. Hey, good evening, everyone. Welcome. I am very excited to bring you sort of a special episode that has came our way. It's Pride Month, and we have a great doctor who's done some research around gay men and prostate cancer. And so I would like to dive right in. Alina Health Cancer Institute President, Urologist Dr. Konety is trying to answer a question that many researchers haven't touched yet. How does prostate cancer impact gay men? It's a topic that piqued his interest when he and his co-researchers started discussing it and surveying hundreds of gay men about this. And here is why he's with us today, to talk about his findings and to share some takeaways for patients and medical professionals. And so thanks for being here. So can you tell us a little bit about your background? I kind of gave like the bio, but tell us about you.
Sure, I'm happy to do that. So hello, everybody, and thank you very much again, Steve, for inviting me to be on this program. It's a real pleasure to be here, given the special connotation of the Pride Month. I'm a urologic oncologist, which means I'm a urologic surgeon who deals with cancer patients. And I finished my training out east, and I've been on faculty in multiple different academic institutions. And currently, I'm the president of the Urology Health Cancer Institute and also the chief academic officer of the Urology Health System. Prior to this, I was the head of the Department of Urology and also ultimately the vice dean and head of the practice plan at the University of Minnesota. I then went on to be the dean of Rush Medical College for a little while before being recruited to head up the Cancer Institute and build our programs here. I've long focused on prostate and other urologic cancers, particularly prostate and bladder cancer, have well over 300 plus publications and several book chapters, et cetera. And lots of my research, along with several of my excellent colleagues, have been funded by many national organizations, including the NCI, the American Geriatric Society, the DoD, et cetera. I must say this particular focus of the prostate cancer research in gay men, I must acknowledge that the leading light in this area is my dear friend and colleague, Simon Rosser, and his extensive team who have really brought my attention to this focus area. And as a group, we've done, I think, some remarkable work in this, which I would love to share with you.
That is fantastic. So what piqued your interest in studying prostate cancer among gay men? How did this come about?
The whole thing came about because when I was at the University of Minnesota, Simon, who apparently knows some close friends, colleagues, and others with this issue of prostate cancer, approached me saying, you know, we've been looking at this area of prostate cancer in gay men, and there's not a lot of work that's been done in this area. At that time, there were barely a handful of studies. There were only two or three studies that had been published in small cohorts of gay men with prostate cancer. And so he came upon the idea that this is an understudied field and we need to look into this further. But he needed to understand if this was important to urologists and needed the urology expertise. So he approached me and both of us started talking about it. And we put together a proposal for our initial study, which was funded by the NIH. That was just our initial foray and survey of a little over 100 men with prostate cancer. We did all online. And then that data and understanding led us to further studies, including analyzing what the attitudes are about men with prostate cancer who are gay or bisexual amongst healthcare professionals, and also amongst the patients and their caregivers. Then this has led to a second follow-on study, which is the first randomized trial that was conducted in gay and bisexual men with prostate cancer. And the intervention was meant to see if using certain specific approaches, we can mitigate some of the side effects of prostate cancer therapy in these men. So we had a group that had received the intervention and a group that did not. And we wanted to see if the interventions made any difference. And the results are pending at this time. So in conducting this work since about 2015, 2016, over the last 6 or 7 years, we've published well over 20 papers and significantly added to the body of literature and understanding of prostate cancer in this important group of men.
Fascinating. So what specifically were some of the findings that you found?
So there's lots of different aspects that we've shed light on, and some of the things were confirmatory, that really reinforced what the early 2 or 3 studies had shown, and then obviously our newest randomized trial will yield some very interesting findings, which are unique in and of themselves. So one of the main things we learned was lots of men, or a majority of the men who were gay or bisexual, did not reveal their sexual orientation to their healthcare professional, particularly to their urologist. For whatever reason, they felt diffident about it, and they didn't feel comfortable revealing that up front. And on the side of the healthcare professionals, they were also not seeking that information. So they assumed everybody was heterosexual, and all the printed material, all the clinical advice, all the complication detailing, all of that was really given out with the idea that they were only dealing with heterosexual men. And so there was clearly a lack of synchrony in the communication between providers and their patients. And this leads to a lot of anguish in the patients, and probably lack of awareness in the providers that perpetuates this issue. So that was one of the biggest things that we found, that it would really facilitate better communication by being upfront and frank. And how do we encourage that? And we actually did a small, Simon actually did a really small side study, which looked at interviewing a lot of healthcare professionals, but also looking to see what would happen if we introduced a questionnaire, or a portion of the intake form really asked for questions pertaining to sexual orientation. So would that be non-threatening, and how would people receive that? How would patients receive that? How would providers receive that? Would there be any objections to people who are not gay in filling out those portions? And we found that that actually was quite well received. That was probably the easiest way to gain such information, by asking everybody their sexual orientation upfront when they come in the clinic, recording that information, using that to tailor the information and counseling we provide to patients. So that was a good learning. And some of the other things that we learned in surveying these men and interviewing them in greater detail was that some of the side effects have different types of impact in gay men compared to straight men. So in gay men, particularly in gay men who are receptive partners, the presence of the prostate is historically valued. There is thought to be a aspect of sexual function that's provides better satisfaction if the prostate is in place versus not. Whether that's true or that's biologically we don't yet know how that functions. But what we do know is that's important. And when you're doing surgery and removing the prostate or affecting it in some way, it's important to outline that to gay men, because if they are the receptive partner, their sensation may change, and they need to be aware of that. So that is one of the things. The other thing we found was, depending on whether gay men and the nature of their intercourse, radiation therapy has some effects on the rectum. And when these effects on the rectum may impact sexual functioning in gay men. And so it's important for them to be aware of that. Otherwise, it can cause more bleeding, perhaps more pain, and so forth. So that may actually make a significant difference. The other thing we found also, that gay men tend to have better sexual function compared to straight men after surgical procedures. Again, I'll caution everybody in this interpretation, because these were all by interviews and some standard formats, but mostly in people that we surveyed. These are not patients who are actually seeing their urologist and the urologist reporting this. These are conducted surveys conducted, either online or through interviews of gay men. But from that finding, it appears that they stay functioning sexually for longer and better than even at older ages than straight men. Some of it may just have to do with the fact that gay men tend to be sexually active much longer. Sexual functioning is much more central to the psyche of gay men, perhaps, and that may be why they pay importance and attention to it, and that may also make them work harder at it. So there may be different explanations, and we're not sure exactly of all of the reasoning behind this, but that's another thing we found. Mental distress, we find, is higher among gay men, even at baseline. And one can imagine that there's many types of oppression and suffering that many of these men have had, particularly the older gay men who are in the prostate cancer age range, because prostate cancer tends to be an age of slightly older men, 50 or beyond, some are over 65. And men who are gay, who are that old, have been through a lot by the time they get there. And so at baseline, they have a lot more mental stress, and adding the stress of cancer multiplies or significantly increases that stress. So that's something that one has to be aware of as well, that these people are coming from a already stressed out, perhaps mental framework, and all of this is going to end the sexual function. The impact that it has a greater meaning for them. And lastly, one other thing I'd like to mention is one of the big issues we did find in gay men who have prostate cancer and get treated for it is incontinence, which tends to occur particularly in men who undergo surgery, but can also occur in men who have radiation, has significant impact. And it is, though sexual functioning may be less impacted, at least by perception, continence functioning is a big issue for them. And there are some aspects of urinary control that we really didn't pay a lot of attention to in straight men that really came to the fore when we discussed it with gay men, particularly something called climacturia. So whether you're straight or gay doesn't matter. After surgery, some men, when they ejaculate, they also tend to leak some urine. If that happens, that can be quite problematic and disturbing, even for straight men, and definitely so for gay men as well. And that's something we need to pay attention to and counsel patients to expect, because oftentimes we were not really pointing that out, or at least I was not, I should say, pointing that out as a specific side effect that people should be aware of. We just talked about incontinence in general, but incontinence that can occur in specific situations we were less clear on. So some of these things really helped us better understand how these things play out in gay men and how it may be different. And also the need for education really came to light as men, professionals, healthcare professionals, urologists, radiation oncologists, medical oncologists are really not equipped to understand how to meet the needs that are more specific to gay men. And educating them, particularly starting from their training period, would be really helpful.
Super insightful. Yeah, I've heard, whether it's gay or straight, there's definitely education gaps in what people experience versus what they're told. Are gay men at greater risk of prostate cancer than straight men?
Not that we know of. We couldn't find any evidence in our studies to really demonstrate that. Historically, there has been a concern that gay men are at a higher risk for cancer in general. And that is also unclear, to be honest. But in terms of prostate cancer, it's not clear that there's any specific increased risk amongst gay men. We had one small subset study that we performed, which suggested that maybe gay men tended to have a slightly higher risk of being found either later or being found with slightly more aggressive disease. I will caution our listeners on that finding, because that needs to be proven, because this is all by interview and that sort of data. It's not hard data where we've actually looked at the pathology and done more rigorous studies. But it is something that we will be looking into in the future.
Are the treatments any different for gay men versus straight men?
No, it is the same type of treatments, and the same options are available for both of them. It's surgery or radiation for early stage prostate cancer that's confined to the prostate. For late stage, we do hormone manipulation therapies. There are newer treatments coming up now, which are dealing more focally with the prostate cancer. So you can identify the spot of cancer and just treat that with a variety of different ways to destroy the tumor. Thereby, you don't have to take the whole prostate out or burn the whole prostate with radiation. But all of these treatments are the same. As I was alluding to earlier, whether you lean one way versus the other in a specific gay person may depend a little bit on their role in a relationship, because impacts of certain treatments will be different for different people who are in different situations in their partnership as gay men.
You hit on a lot of things, but what would be like the most interesting finding from the research you've done?
The most interesting finding, to be honest, would be, if I was to say one single thing, is the complete lack of candid communication and the extent to which that was pervasive was really the most surprising thing. because we found a predominant majority of gay men really didn't talk about their gayness to their provider, and neither did they ask. And that's the starting step. So if you're not even on the same page from the very get-go, how are you going to have a trusting relationship that attends to the needs of your patients and vice versa? So I think that's going to be
I've asked guys who have gone through some of the toughest rounds of treatments and everything. I'm like, how did you ever come to terms to get it? And it was always about the trust in the relationship with their physician, is how they accepted it. So
Yeah.
to not have that sounds like something that's really got to be addressed. That's interesting. So what would you like professionals to know?
I'd like professionals for sure to know that this is a gap of understanding in this area, and that this is a specific minority of men that has unique needs, and that they need to pay attention. One, to actively either listen or seek out the information about sexual orientation, and then tailor their recommendations based on that. That increases the trust, increases the confidence in the treatment, and is definitely better for the patients. I think more work is needed in this group of people, and I think healthcare professionals, particularly physicians and other researchers who are involved in caring for these men, would behoove them to continue to explore this and identify nuances in both the treatment and the side effects, and also in the biology and how that is affected. And lastly, I would say one other thing I would like healthcare professionals to keep in mind, that there's another subset of people, particularly transgender men who have become women, who still have their prostates left in place. While the change in gender may have some impact on whether prostate cancer does occur or the frequency with which it occurs because of some of the hormonal changes, it is possible that some of these men who have become women will ultimately develop prostate cancer. And unless somebody's paying attention to checking their PSAs, we may miss the boat on some of these things. So I think it's important for a healthcare professional to keep that in mind as well.
Is there anything you'd like to ask me?
As an organization that's really focused on supporting and providing care for men and people with prostate cancer, what can we do? What do we need to know as healthcare professionals to help you all in your work?
I think I want to start with a story. I was very fortunate because of my work. I've been able to travel and to listen to other experts and other patients, and been in a lot of settings. And one of the trips I made, it was several years after I had been diagnosed, several. And I was in a room, and there was a row of doctors. There was several rows of patients. It was a fairly large room. And one of the gentlemen who he was a patient, he became an expert on sex, specifically around prostate cancer. He had gone back to school to learn about it. He was so fascinated with the subject. And he asked those doctors if they had been included in their education, and they all were like, no. So and then he asked them if they were comfortable talking about it, and the answer was no. And he shared things that day that I had never heard. And I know that it's an uncomfortable subject to talk about, but it's such an important part. And it kind of reminds me, what I've seen kind of reminds me of when you're talking about what you saw. There is this this knowledge gap. Like I'm not positive that the information exists, and I want whether it's gay men or straight, I'm a straight man, but whether they're gay or straight, we need to be able to have open and honest, educated conversations. It's always going to come out better to know things than to assume things. The assumptions are always either wrong or worse than reality. And it's also best, I am positive, when men know what to expect, so they're not surprised by the side effects of treatments, I think they do much better. And when they come and they are sharing stories how something shocked them, it's always a worse situation. And so anything that we can do to close that gap And then also, I just want to emphasize this. I'm really grateful for your work, and I want everyone to know, whether you're gay or straight or black or white, it doesn't matter. Everyone is going to be loved and supported at our meetings. And I know with my peers around the country, we all feel the same way. It doesn't matter. And I want everyone to know that they're welcome in our groups, whether it's online or in person. And it's not just ours. I know my peers around the country, we truly are trying to help our fellow man and their partners and everyone. And so I just want to say, I'm proud that we put a little dent in the issue here in Pride Month. And I think this is a very positive thing that we have done and you're doing. And so thank you very much. And everyone, you'll have a nice evening out there.
Thank you very much. And thank you for having me. And I'd like to, again, acknowledge this on behalf of all my colleagues and co-researchers who have really done all the hard work in this area.
Thank you all.
Thank you.